Welcome to KS Medical Coding Academy. In this session, we'll review the fiscal year 2026 ICD-10-CM update, effective October 1, 2025. This year's update from CMS includes 487 new codes, 38 revisions, and 28 deletions. Let's break down the key changes, chapter by chapter. Overview. These updates affect multiple specialties, from primary care to oncology, neurology, and emergency medicine. The focus this year is on greater specificity, new codes for social determinants of health, and expanded categories for certain diseases. Symptoms and signs. Chapter 18 sees 16 new codes for pain and tenderness in specific areas: pelvic, perineal, abdominal, and flank. R10.2 for pelvic and perineal pain is now a parent code. We have a new R11.16 code for cannabis hyperemesis syndrome, nausea and vomiting in long-term cannabis users. Also, 5 new codes identify costovertebral tenderness more precisely. And for immunological findings, R76.8 is now a parent code, with R76.89 for raised immunoglobulins not otherwise specified. Social determinants of health. In Chapter 21, Z59.86 for financial insecurity is now a parent code with 3 specific subcodes. We also have new Z77.3 codes for exposure to war theater. Food allergy coding has expanded. Z91.011 for milk allergy and Z91.012 for egg allergy are now parent codes, each with 3 subcodes for better specificity. Oncology. In oncology, C50. A for malignant inflammatory breast cancer is now a parent code with 3 new specific codes. D71, for functional disorders of polymorphonuclear neutrophils, also becomes a parent with 3 new codes. Z15.0, for genetic susceptibility to malignant neoplasm, adds Z15.06 for digestive system cancers, which branches into colorectal cancer and other digestive malignancies. Emergency Department. ED-related updates include new codes for contusions of the abdominal wall, groin, and flank, S30.11, S30.12, and S30.13. Food-related anaphylaxis is now more specific. T78.07 covers reactions to milk with baked milk tolerance, and T78.080 covers reactions to egg with baked egg tolerance. Neurology and Neurosurgery. G35 for multiple sclerosis is now a parent code with subcodes for relapsing remitting and primary progressive MS. There are also new codes for congenital malformations, Usher syndrome, and neurodevelopmental disorders related to specific genetic variants. These begin with the new QA0 category. Eye conditions. In Chapter 7, H01.8 for other eyelid inflammations is now a parent code, with options like H01.81 for right upper eyelid inflammation. We also have new parent codes for thyroid orbitopathy, H05.83, and neovascular secondary angle closure glaucoma, H40.84, both with laterality options. Musculoskeletal. Chapter 13 adds M05, A for abnormal rheumatoid factor and anti-citrullonated protein antibody with rheumatoid arthritis. M21.159 is revised to specify hip varus deformity. There's a new code M24.076 for loose body in unspecified toe joints, and M61.129 now specifies myositis ossificans progressiva in either upper arm. Genitourinary. In Chapter 14, N00, B for acute nephritic syndrome with immune complex membranoproliferative glomerulonephritis now has subcodes for idiopathic and secondary types. N04, B for nephrotic syndrome has the same subcode structure. N07, B is added for hereditary nephropathy with a POL1-mediated kidney disease. Drug-related adverse effects. Lastly, a new parent code, T36, A, covers poisoning, adverse effects, and underdosing of fluoroquinolone antibiotics, with subcodes for accidental, intentional, and adverse events. To summarize, there's greater specificity in diagnosis reporting, more codes for social determinants of health, and important specialty updates for oncology, neurology, emergency medicine, and more. Review the full CMS list before October 1st to ensure coding accuracy. Thank you for joining KS Medical Coding Academy. Let's keep coding smarter and staying compliant.